This is an x-ray of a patient. I was suspicious of an area on his lower right. I said, in the mouth, it looked a little like something could be going on between his teeth. I looked at the x-ray, kind of was back and forth, hemming and hawing. It was just really hard to tell. It was obviously something that wasn't really large in size, but I don't want decay sitting in my mouth, so I wouldn't want it in my patient's mouth either. So anyways, I was kind of back and forth. The x-ray wasn't real conclusive. So this is what I found. It comes up in black and white when we use the loom. This is between the patient's two teeth, and this is the area that I was obviously seeing. So this is the patient's cheek, and this is the patient's tongue. So the decay was sitting kind of towards the tongue side, and when we take an x-ray, that x-ray had to go through all of this healthy tooth structure before it would pick up any breakdown in the enamel there. So obviously when I see this, I can see that that decay has made its way through the enamel, it's gotten into the dentin, the inner part of the tooth, and I decided obviously that we need to fill that for the patient. So had I not had the loom, I probably would have said, well, let's take an x-ray in 6 months and see what it looks like. So this is a patient. It looked like a small area of decay to me when I examined her. This is again the type of cavity that's not going to show up on an x-ray. It's just in the chewing surface in the groove. So it was nothing that I could see on an x-ray. It was just something with my trained eyes that I could see. So I opened up her tooth, and the decay was quite extensive. Everybody has a different decay pattern. So for this particular patient, the decay was pretty extensive. Removed the decay. The groove on the back of the tooth, I was kind of hemming and hawing. Looked a little suspicious, but based on how deep the decay was, in this area of her tooth, I did open the back groove. A little surprised to see the decay obviously extensive in the groove in the back of her tooth as well. So these photos are just good for the patient to see. When I say, it's a deep filling, I got in there, it was close to the nerve, you might have some sensitivity. This is why. It's a little bit blurry of a picture, but she's all restored. Nice white filling in there, and she's nice and healthy.